Okay, we answered the door. The mailman was there. This is a pattern I've discovered in which a person has limited hip rotation, but the traditional way of testing the hip fails because most of the research shows that testing hip rotation with the client prone and the knees bent 90 degrees is the ideal way of testing it. And that's typically the way that it's tested for what's called piriformis syndrome. And what I find is that people may have normal hip rotation in that context. But when you look at how the hip rotates, when the hip is in neutral and the knee is in neutral or normal extension, in other words, like this person laying on her back, okay, I find that there are restrictions that get missed unless one specifically screens for them, okay? And this is one of the ways that I screen. I rotate the entire lower extremity just to get a sense of how far it goes. And it looks to me like it goes internally perhaps 25 degrees. And then on this side, I pull it into an end range, and this one looks like it's about 15 degrees. There's a distinct difference in the free mobility. Okay? Then the next thing I do is I do an overpressure test. So I'll rotate this one into internal rotation to that mark of it's either 25 or 30 degrees, and then I'll overpressure it. So I'm adding additional force. Okay? So then I'll roll this one into that natural stop. It hits a natural stop point there, and then I will overpressure it, and there's nothing. You know, I cannot enhance the mobility. Okay, can you lie on your stomach, please? So the other way that I test that is to do a posterior to anterior spring on the trochanter. All right? So I'm going to show you a spring on her right trochanter. And it's right outside the front pocket. And you feel around that area and you'll feel a bump, which is the trochanter, and then you just come posteriorly. And there's a flat margin on the back of that trochanter. So, I take up the slack. You can see that I can push into that structure and take up the slack, and then I can spring and impart additional force, and it moves and it recoils. And I can see her heel bounce every time I do that. So let me change the camera view so you can see the heel there. So right now I'm taking up the slack, and right now I'm springing it, and it's, the movement is going through the body all the way down, and all the way through the lower extremity. On the left side, however, it's blocked. I'm going to point to her left heel right now. And right now I'm taking up the slack, so you may have seen a very slight movement there, and now I am springing with more force than I did on the other side, and it's absolutely static. There's no motion moving through the trochanter, through the hip, into the femur, into the rest of the femur and down into the lower extremity. So I'm going to show you what that looks like at the posterior trochanter. So I can take up the slack, but it takes up so very quickly. And now when I try and increase motion there, nothing happens. So I'm going to restore that motion in that hip, and it'll take me about 5 minutes. And I could show you the after effect, which will be dramatic. But I'm more interested in the long-term effect, which will be if that helps reduce her plantar fasciitis type pain. So I'll stop filming here, and we'll do a sequence shortly. Thanks.